Good morning everyone. In previous classes I have discussed the neuron, the types of the neuron, the neural glial cells. Today I will discussing about the receptor. What is receptor? Receptor. Receptors, these are free nerve ending. These are the free nerve ending which are present at the peripheral termination of the afferent fiber. These are free nerve ending and are called receptors. It is afferent fiber, not the efferent fiber. By the afferent fiber, we carry the information. Towards the central nervous system from outside or inside the body. We receive the sensation within the body or outside the body. For example, the pain receptor, pain in the abdomen, pain in the right hypochondrium, pain in the appendicitis or gastritis. These are the pain which are received within the body and in the outside the body. Outside the body, just like the pain, just like the temperature. These are the sensations which are received outside the body, and these sensations are carried from our body through the afferent fibers. And these afferent fibers, at the end of the afferent fibers, these nerve endings are present. Now, what is receptor? Now we will define the receptor. It acts as transducer, and it converts a stimulus into a nerve impulse. A receptor acts as transducer as it converts a stimulus into a nerve impulse. Now the classification based on location and information provided. The receptor can be three types. One is the exteroreceptor, second is the proprioreceptor, and third is the interoceptor. Exteroceptor, proprioreceptors, and interoceptors. Exteroreceptors are located at or near the external surface of the body. Exteroreceptors, they are located at or near the external surface of the body, thus providing the information about the external environment. That is called the exteroreceptor. And these receptors are concerned with the sensations such as pain, touch, temperature, and pressure. These are the exteroreceptors. That is the cutaneous receptor. These are located near the external surface of the body, and it is present at the external environment. It is present on the external surface. It means it provides information about the external surface of the information about the external environment. And these receptors are concerned with sensation, just like pain, just like touch, just like temperature, and also the hearing, vision, and smell. These receptors, these exteroreceptors, these are of the two types. One is the cutaneous receptor and second is the spatial sense receptor. First is the cutaneous and second is the spatial sense receptor. These receptors, what is cutaneous receptor? These are receptors which are concerned with the sensation, just like pain, the touch, temperature, and the pressure. Touch and temperature, just like we touch with the pen. We touch our hand with the pen, that's the touch receptor. We touch our hand with the candle. With the candle, it means it is the temperature. And we press your hand with the tip of the finger, that is the pressure receptor. The pressure receptor, the touch receptor, and temperature, these are the cutaneous receptor. And second is the spatial sense receptor. Spatial sense receptor, what is this? These are concerned with the sensation, just like the hearing, the vision, our senses, eye, ear, tongue, smell, and taste, nose. These are the receptor, spatial sense receptor, which are responsible for the sensation, just like the hearing, the vision, the smell, and taste. These are the receptor. These are the spatial sense receptor. That is the exteroreceptor. Second is the proprioreceptor. What is proprioreceptor? These are located in the skeletal muscle, tendon, joint, and inner ear. Hair cells are present in the inner ear. These are located in skeletal muscles, tendon, joint, and inner ear, that is the hair cells, and they provide information about the body position, orientation of the head, contraction of the skeletal muscles, and position and movement of the joint. These provide information about the body position, orientation of the head, contraction of the skeletal muscles, and position and movement of the joint. That is the proprioceptors. Next is the interoceptor. Interoceptor are located inside the blood vessels and visceral organ. The visceral organ are just like the spleen, the liver, the kidney. These are the visceral organs. These are receptors located inside the blood vessels, and it's called interoceptor. And proprio receptor are located in our skeletal muscles, like skeletal muscle, the tendon, the joint, the shoulder joint, the hip joint, the knee joint, and in the inner ear, just like the hair cells, the tendon, and information about the position, what is the body position, orientation of the head, the anterior position of the head, lateral position of the head, and skeletal muscle, contraction of the skeletal muscles, just like the biceps muscle, the triceps muscle contraction, and position and movement of the joint position and movement of the joint. These are the proprioceptor. And interoceptor, they are located inside the blood vessels and visceral organ. Thank you.